My name is Jan Tilley, and I am so happy today to have Mesha Biden with us. She is a certified diabetes educator as well as a registered dietitian, and she works in our offices at JTA Wellness. So welcome, Mesha. So glad you could be here.
Thank you so much.
Let's see, what about telling people what diabetes is? Can you define that for people?
So diabetes is a chronic disease in which blood sugars are elevated, and when we eat, our food, specifically carbohydrate foods, are broken down into glucose, and cells use this glucose as energy. But in order for that energy from glucose to be brought into the cells, our pancreas produces insulin. And this insulin is kind of like a key that unlocks the door to the cell to allow the glucose to go in and make our body able to use it. In type 1 diabetes, the pancreas makes no insulin. And in type 2 diabetes, your pancreas makes some insulin, but your body can't use it quite as efficiently. And so in both of those diseases, the blood sugars increase and lead to very serious complications.
So I think that's such important information because a lot of people don't know the difference between type 1 and type 2.
Definitely.
Why is it so important to control blood sugars?
So if your blood sugars are elevated consistently over time, it can cause nerve damage. And this nerve damage can affect your eyesight, can affect your kidneys, and also your extremities. There's a condition called neuropathy, which causes nerve pain in your hands and feet, and that can lead to poor mobility or, in very, very serious cases, amputations of your limbs. And when you have diabetes, your risk of heart disease and stroke is also higher. So there's so many different factors that go into play, making it important to control your sugars.
Yes. So what are some symptoms? How do people know if they're going high or low?
Yeah, so the classic symptoms of low blood sugar, also called hypoglycemia, are shakiness, sweating, blurred vision, hard time concentrating, and that's classified as a blood sugar less than 70 milligrams per deciliter. And then the high blood sugars, also called hyperglycemia, which is sugars over 180 milligrams per deciliter. Those symptoms include frequent urination, being very thirsty, and headaches. And both extremes can be very dangerous. If you have too low a blood sugar, the extreme symptoms would be fainting, seizures, or even death. And like we talked about, if you have high blood sugars for a consistent period of time, those complications could be detrimental as well.
Have you ever noticed that there are people who come in that don't know when they're high or low?
Definitely, and we call that either hyperglycemic unawareness or hypoglycemic unawareness. So really listening to your body, checking your blood sugars, and trying to help you understand how your body is telling you if the sugars are high or low.
Right. When do you tell people to check?
So typically the recommendation is fasting blood sugars, which is taken in the morning before you eat or drink anything. And then depending on their doctor's orders or how their blood sugars have been going, they may check 2 hours after meals.
Okay, that's a really good rule of thumb, and it really helps people understand how to better manage, right?
Definitely.
Okay, so you mentioned that carbohydrate foods really tend to spike your blood sugar. So are there other foods that you can mention, specific foods that you can mention that they should avoid?
Yeah, so carbohydrates, that is looking at like your breads, pasta, rice, the starchy veggies, so potatoes, corn, peas, fruit juices. Our dairy products contain some carbohydrates, and then sweets like candies, cakes, and cookies. And I always tell my patients these foods aren't necessarily unhealthy, but their body, because they do have diabetes, can't process it or metabolize those foods quite as efficiently as somebody without diabetes.
So rather than those foods being off limits, what can they do to have a little bit of those foods?
Yeah, so when they come in, we individualize a meal plan for my patients. And so I really want them to understand the quality carbohydrates they need to include and the portion size. In addition to pairing those carbohydrates with foods that won't spike their blood sugars, like the lean protein, the healthy fats, and the non-starchy veggies.
Yes, so those really help stabilize the
Definitely.
carbohydrate, right?
Definitely.
And so I feel like a lot of times diabetic patients come in and they think, oh, I can't have rice, pasta, potatoes, bread. But really, our approach is you can have a little bit, just a tiny bit, but then you always have a protein or a fat with it. So that's great information. Go ahead.
Or I have patients that come in and they tell me that their doctors or physicians have said don't eat bananas or don't eat any rice or pasta or bread. And as a dietitian, I plan to continue to eat those foods the rest of my life, and I really want to teach my patients how those foods can still fit into a meal plan even though they have diabetes.
And often I tell people, your physician probably said that because they have 5 minutes with you.
Correct.
But that's why they sent you to a dietitian, so we can help you learn to incorporate that.
Exactly, and make lifestyle changes based on their conditions.
Adding in some exercise and things like that. Awesome. So tell people what a certified diabetes educator does and how you could help them.
So since I'm a dietitian and a diabetes educator, I can help them come up with a realistic meal plan that incorporates their favorite foods, their lifestyle and routine, all while managing their blood sugars. And I'm trained to look at their medications for diabetes, their blood sugars, some other labs to really fine-tune that meal plan, not only to help with weight loss or weight management, but really control those blood sugars and prevent heart disease, since those two are so linked.
That's great. And really, they say that diabetes is the 7th cause of death in the United States. So it's usually linked to heart disease, kidney failure, a lot of those. So even with that, the numbers are probably even higher. So it's definitely a disease that needs to be addressed. So can you tell people how they can get in touch with you?
Sure. So they can call our office at JTA Wellness, which is 210-545-4422, or go on our website, jtawellness.com, and hit request appointment, and I'd be happy to meet with them and helping them just live their best life now.
Awesome. Okay. Thank you, Misha. I appreciate you being here.